This is the birthing simulator P90. You see the P90 Pro version here. It's also available as P90 Basic. Both simulators have the same fetus. As you can see here, it's a fully articulating fetus with legs, arms and a movable head. It also has a mouth opening for better movement during special maneuvers. It's made of soft PVC. It has a detachable umbilical cord and a placenta. You can easily detach it by just screwing the umbilical cord. Also the placenta can be detached. The cord can be cut and reconnected up to 5 times. Please make sure that the cutting takes place quite close to the end, so you can reuse it up to 5 times, and after each cutting it will be a little bit shorter. The placenta is also made of soft PVC. It has some Velcro sticks here, so you can place it inside the mother and inside the uterus. There are 2 pieces that can be turned around, also with some Velcro sticks, and if you place it with these 2 pieces on the Velcro inside, during retention of the placenta, these pieces will stay inside, and then you have an incomplete placenta birth, so you can simulate this situation, and then the student has to remove the single parts out of the mother. Okay. So I will bring it back together, just reconnect it by screwing in here, make sure that it's really tight. Do the same with the fetus. Okay. The torso of the P90 offers a very detailed, anatomical correct structure. So it has all the landmarks you'll find in a female lower abdomen. So the bone structure. You have the spine here with the sacral bone, the pelvis with the symphysis, and also this typical S-shaped birth canal. So it's not only a flat base that shows this typical curvature. On the back side of the torso you find some rubber plugs that assure a safe position on the table. If you have breech delivery, for example, you want to make sure that the torso really stays on the table, on the bed, because you have to apply a lot of pressure. Therefore you can also use a belt that wraps around the table or the bed, and this will be fixed on these 2 positions here. You have a handle bar on this end. This will help you to perform the manual birthing. I will show you later. You can see that there are some pins on the pelvis and also on this side. On the pelvis we can install a soft silicone birthing canal with a vulva, and also a soft silicone portio insert. And these pins will be used to connect the belly skin. I will show you how to insert the birth canal. It has a connecting pin on the bottom. This will go inside here. So just take the insert coming from top, putting inside, and then make sure to bring this pin in here. Okay. Wrap the upper end around the pelvic bone structure and just pull the silicone over the screws. You don't have to open or remove the screws, just use the flexibility of the silicone, just wrap it over the screws. Okay. Make sure that the skin goes over the bone structure, like that. Then, secondly, the portio insert. There is a special shape that fits over the spine, so you can see the orientation needs to be like that. And do the same like with the birthing canal insert, just wrap around. This is the skin cover that wraps all over the vulva and belly part. So you have to start with this part really down here inside the torso. Okay. To insert the skin, just push back and lift the silicone insert, and this connector needs to get here on this white pin. Okay. Okay, now you can take the skin, just put it all over the torso and start connecting all single pins here. Just push it over the white plastic pins. It is a little bit different in the back. There's just a hole inside the skin, and you have to bring this in position like that. For the Pro version, we also offer uterus insert. This is like an artificial part of the uterus with an artificial uterus wall. This can be cut. Here you can see the insert for cesarean section. This is a silicone insert that can be cut on any position. For the basic version we have a PVC insert that is already pre-cut, and there's one opening where you can just take out the baby. With this one you can simulate a real surgical procedure. So cut it, really stretch it, and get the baby out. I will now show you how to remove this insert, because this will allow us a better view on the inner structure. Just take out this whole piece. Just pull it quite close to the pins, would be the best way. If you perform cesarean section, make sure that you secure these pins with the back cover from the inside. You will find in the accessories. Now you can also see that there's a second structure beneath the silicone. This is like the underskin tissue. You also now see the uterus wall that can be cut as well and tear apart or to open. I will remove this as well. I will bring back the uterus insert, and now you have a nice look inside. You see the uterus and the birthing canal. If you bring in the baby, you can create any position of the fetus by manually rotating the baby, and you can easily show the student through this opening. Before I start with the birthing maneuver, I will show you how to secure the simulator on the table. As I already mentioned, there are 2 connection points on the back. So take the Velcro strap and first of all fix it on one side just by getting the 2 Velcros together. Then get this strip here on the other side and connect it here as well. You can pull until there's a safe position, then connect it with the Velcro. So now the simulator is really fixed on the table. With this simulator we can also create a scenario with an artificial amniotic sac that's still intact. We use this very thin foil, only one, and this will be placed inside the portio. Therefore I have to remove the skin to get a better access. Just the upper part, like that. So actually the baby will be positioned in any way like this or the other way around. And the point is that the amniotic sac is still intact, which would wrap the whole baby normally. But for simulation purposes we just use this foil that sits inside the portio, so that if you look from the vagina, you will see first of all the amniotic sac filled with fluid, and then see the baby's head or the breech delivery. To set up this scenario, you use this foil, place it over the portio, and push it inside like that. Then there are some holes inside the foil that can be pulled over the screws like that. You don't have to fix it on every single through just 5 to 6, something like that. It's just that the foil won't slip out. Okay, make sure that it's all down the port seal. Then you can fill in some water. Just pour some water inside. I think it's about 500 milliliter maximum. Just make sure that it won't get out on this side and just stays inside the cavity of the port seal. And then you have this artificial amniotic fluid. Just use, this is the transport cap, just remove it and use the other cap with a lid and just put in some drops of this fluid. This will make the baby glide through if the amniotic sac is ruptured. Okay, if everything is set and the fluid is inside, you'll be able to look inside through the vagina and see this filled sac and just rupture it, and all the fluid will get out here and will mimic an aeron. Okay. For any birthing simulation or maneuver, it's very important to use the lubricant gel, that the baby will glide through all the silicone pieces. Otherwise it can stuck and you might destroy any of the flexible parts inside. So use a lot of lubricant gel and also renew it after a while, because it can dry a little bit. Just try to bring it on any place inside the birthing canal and also the vulva and on top of the baby. So on the back, on the shoulders, and if you're planning for breech, also on the buttock. Okay, the more you use, the better it will glide through the birthing canal. Okay, so to perform any birthing simulation, you have to bring in the baby from the back and find the initial position for the baby. For example, like that. Then it works like that. You have one assistant on the back of the simulator, using one hand to secure the simulator on the handlebar, and using the other hand to push and to rotate the baby through the birthing canal. With this baby, you can maneuver in any way. It's not limited to any direction or position, so you can choose the speed and the rotation on your own. So the assistant needs to know how the baby should move through the birthing canal. And if you gently push and rotate, you can see the baby coming out like that, and then another rotation on the back. Bring it out. So the placenta is still inside and can taken out through the birth canal as well. If you use some gel on the placenta, this will even go more smoothly. You can place the placenta in any area of the belly. If you use the uterus insert, you can even put it here on the Velcro or inside here, also on the Velcro strap. You can position the placenta in front of the portio to create some complication scenario. You can also place the umbilical cord in any way to have it in front of the baby's head. You can have it wrapped around the baby's head. So any complication can be simulated. And as I already mentioned, you can have the breech delivery as well. So in this case, the baby would enter the birth canal with its back. In this case, it's recommended to use one hand and pull or push through this opening here to get the first entry, because it's a little bit more force you need to get it inside, and then just proceed like with a normal delivery. Then you can get inside the simulator and search for the mouth opening of the baby. Just try to get it out like that, secure it with the finger. Okay. With this simulator you can easily perform a simulated shoulder dystocia. In this case, the baby will stuck on the symphysis, on the pelvic bone, with one of the shoulders. So if you insert the baby like this, and normally the rotation would bring the baby like that. In this case it will stuck here on the bone. You can bring out the head. This is possible, which is a typical situation. So the baby's head is born, but it's still stuck here with the shoulder. In this case, the doctor or the midwife can get inside and do some rotational maneuvers to get the shoulder free, and then the rotation can fully take place. And birth can be proceeded. We just took away the skin to show you, but it also works with the skin and the uterus insert.